Good afternoon, everyone. Thanks for tuning in. At Wider Circle, we began focusing on loneliness and isolation as a primary driver of health outcome and quality of life back in 2015, when we realized that being estranged of your fellow man erodes motivation to live, causes chronic depression, and undermines the effectiveness of all care management efforts. On our journey to address loneliness and isolation, we've developed a new community care model. Its foundations are more able neighbors supporting their less able neighbors, and the meshing of analytics and the psychology of influence to form lasting neighborhood groups or circles of health plan members. Many of our circles were formed in 2016, still meet today, and members of those circles inform, support, and motivate their neighbors to achieve better health in a culturally competent manner. As we have seen through a series of data experiments, when your circle is bigger, life is better. Engaged members are happier, healthier, more active, and overcome isolation. The pandemic has upended everyone's life. But in those pre-pandemic days, a Connect for Life chapter in a typical community would look like this. 1,000 members or 100 neighborhood groups would be led by 50 plan members, those more able members who volunteer with us as community ambassadors. Together with Wider Circle facilitator employees, they plan monthly activities in which they would meet, break bread, move, and talk about how to access benefits in their area and solve the barriers to doing so throughout churches, community centers, and restaurants. And over time, these communities become trusted delivery networks that are very pliable, offering an alternative to a PACE program that eschews the need for real estate. Extreme confluence of challenges to health, employment, home, and access to resources that are compounded by sheltering in place and social distancing increase the risk that COVID-19 pandemic would unleash a pandemic of depression. Realizing that, Wider Circle adapted its model, offering a suite of distance socializing solutions and combining those with critical on-the-ground services. To deliver those critical on-the-ground services, we partnered with leading food banks and the like of Uber Eats. Those partnerships has enabled us to deliver more than 80,000 meals to the Californians we serve. And through our army of volunteers, we're able to perform more than 75,000 health and welfare check-in calls. On those phone calls, we'll assess how someone is doing. In case he doesn't know how to connect with his healthcare provider, our facilitators and buddies would teach him how to do so. In case there's a critical food need, we'll connect him to a food delivery service or deliver the food ourselves. Lastly, we'll ensure that the member with whom we're speaking has critical access to his maintenance medication while sheltering in place and being unable to reach his neighborhood pharmacies. As we've done these calls, 30,000 of those members expressed a desire to receive a support or buddy check on a weekly or monthly basis. And we have paired 30,000 of those seniors with buddies who are members just like them, offering them support throughout those difficult times. Creating a web of support around each member has led to significant impact for Medicaid managed care organization whom we served in the last 5 years. It started with close to 50% increase in engagement with preventative care, which translated to close to an 80% decrease in hospital admission. And when members were admitted, this web of support that we wrapped around them led to a 60% decrease in hospital bed days. This all translates to payback period shorter than 1 year, with an ROI profile of 3 to 4x by year 2 as you establish scope and build those Connect for Life chapters like the one I've shown you a couple of slides ago. Life is better when our circle is bigger. Now more than ever, wider circle can help. We have proven results serving Medicaid managed care organizations in more than 135 communities in 4 languages. And we welcome the opportunity to be of service to your organizations. My contact information is at the bottom left corner of your screen, and you could reach us also through our website. Thanks for tuning in.